Dr. B here with the series on the Mentally Strong Method and the categories within the method. Today's focus is on trauma. I am Cristi Bundukamara, psychiatric nurse practitioner with over 20 years of clinical experience and have personally gone through lots of hardship to show that we can be mentally strong regardless of your story. And when it comes to trauma, this is a very difficult story to be comfortable with. We treat lots of people with various types of trauma. Physical and sexual abuse in childhood, physical sexual assault in adults, military trauma, catastrophic trauma. There's so many things that change who you are, and that's how I identify or define trauma. It changes who you are, it changes your perception, and there's actually tons of research that it changes biochemically what goes on in your brain. So if you've never experienced trauma, you still need to understand how you would process trauma and how the brain works in that, and supporting those around you who have experienced trauma. Unfortunately, we have a lot, and maybe it seems like a lot because of what I do for a living, of people who have experienced things that should not even be discussed. And here I have to help them process that trauma, process that to be able to be strong and move forward and to be comfortable in that story. We have interviewed people on our podcast who have experienced trauma, so I encourage you to look at that. I encourage you to follow us as we will continue to maybe put out a course on trauma, because it is very complicated. And this is why it has its own category. So I think when someone has experienced trauma, and especially if they are diagnosed with PTSD, everything goes back to that trauma and processing that trauma. And there's lots of therapists that do great work in helping people process that trauma. But sometimes I send a patient to a trauma specialist and they open Pandora's box and we can't get it organized. We can't get it to that person to be able to function, and they actually decompensate rather than get better. So I challenge you, before you actually unpack that trauma, that you have the tools, the foundation to process that and move forward from that. And this is where the Mentally Strong Method comes in. So the Mentally Strong Method, 3 words I want you to remember: think, organize, choose. The trauma category is in the organization, but it's not your only thing going on in your life. Maybe you believe that if that trauma wouldn't have happened to you, you would have been completely fine. And that may be 100% true. But the reality is there's lots of other things that have formed your personality, that have formed the way that you interact with the world. And you have to help organize those things so that they're put in the right place. So when we're doing the Mentally Strong Method and you think through things and you're organizing it and you have identified trauma, it goes in a very special box, and it's not always dealt with right away. Because, like I said, we could open Pandora's box, open up all of this trauma, especially if it's complex, prolonged trauma. You might not want to open that right away, right? And so we look at the other categories and strengthen you in those other categories. So many people with trauma have enormous negative self-talk, and we'll have another video on that. But let's start talking nice to ourselves. Yes, that some of those negative talk, that dialogue started at the trauma or was reinforced at the trauma, but you have the power to control those negative thoughts. Unfortunately, don't feel like you had the power or didn't have the power to control or not have that trauma happen to you. And we cannot always control our environment. We want to be safe. And there's all these courses and teachings and people that say you can be safe by doing X, Y, and Z. But I'm here to tell you, and I didn't have trauma at me, but I could do everything I was supposed to do and I couldn't save my son. So you could have done everything right and still have been a victim of that trauma. And so when we start to identify that, when we start to organize that, and we unpack and strengthen you in some of those other categories, it gets you ready to process that trauma. Because that trauma did more to you than just the trauma, the physical or sexual assault or whatever happened to you. It's not just that event or that series of events. It is what it did to you. What did it do to your core connections and your triggers? And what did it do to your feeling of safety and justice in your world? What did that do to your relationship with God? Those are all separate categories that I want you to strengthen before you deal and unpack that trauma. And so that's why it's a separate category. But unfortunately, trauma has affected everything else. You're probably more of an anxious person. You probably have more negative self-talk than other people. Your core connections run deeper. Your injustices are truly not fair. That is a true spiritual conflict. I hear story after story of young children who begged for God to protect them in the midst of their trauma, and it still continued to happen. That is a spiritual conflict. And so, unfortunately, trauma bleeds into every other category in the Mentally Strong method. But what we try to do is help you put that in its category and then strengthen yourself in all of the other categories before we start unpacking that. And there's trauma specialists that unpack it. There's EMDR, there's emotional freedom technique, which you can learn and do yourself, which is why I like it, to help disconnect the trauma, the feelings, the emotion behind that trauma, and help you to disconnect from that. But that's just doing that is not going to help you in all the other categories. Again, that's why in the Mentally Strong method, we think organize. You've got to organize you. What's going on with you? What is affecting you being able to move forward? And so in trauma, I challenge you that your choice be to overcome that, to be comfortable in your story, to not let that thing, person, situation, event hold you back from your full potential. I truly believe each and every one of us is mentally strong, and trauma is one of the most complicated, especially with complex or multiple trauma. But I do believe, and I want you to believe, that you are mentally strong.